I'm Dr. Maharsh Patel, one of the hand and upper extremity specialists here at Ortho Georgia. And today I would like to talk to you about arthritis of the hand. So a lot of people, especially as we get older, have issues with the bones and joints throughout the body. Hand arthritis is also one of the things that most commonly affects individuals. And that could involve any joint, including joints of the base of the fingers, kind of down by the wrist, and then also the base of the knuckles that people most primarily notice, especially when they get swelling or pain, as well as the other joints in the fingers, including the very tip. The most common area and location is usually the tip joint that allows you to kind of bend the very tip of your finger. And a lot of people that have arthritis there also end up with a cyst, what we call a mucus cyst, as the joint fluid gets pushed out. And then the remaining joints in the fingers can also be affected, though they are less common. The second most common would be the base of the thumb, which is basilar joint arthritis. And treatment for a lot of these maladies includes a lot of non-operative stuff, such as anti-inflammatory creams like Voltaren, or sometimes people have been using other types of topical agents that work equally as well. A lot of the times, if the topical stuff does not work, then we will use something like a Tylenol arthritis or anti-inflammatory medicine for those that are able to take it. In addition to that, sometimes we try some occupational therapy, and we have a number of certified hand therapists here at Ortho Georgia that are wonderful and will take really good care of any of the hand and upper extremity issues that people may have. Also, cortisone injections, which a lot of people ask about when they first come to see a hand specialist. They are very good options, though sometimes we don't rush into that because at times, especially if you don't have much joint space left due to the arthritis, it can cause a lot of pain when we inject the medicine into the joint. If you can imagine, it's almost like blowing up a balloon inside of that joint capsule, which is the tissue around the joint that every joint has. And then if the conservative non-operative measures fail, then the next step would be surgery. And there are different surgical options, and those depend on the joint. For example, the very tip joints, we don't really replace because they just haven't shown in the history of those types of surgeries to do very well. So instead we would fuse those, and that could be done in a multitude of ways with either a screw on the inside of the bone or wires or a plate on the outside. The joints, as we get down closer to the middle knuckle and then the big knuckle here, those can be replaced with silicone implants, which again, the surgery itself is relatively quick, about a 15 to 30 minute procedure. It is outpatient, and we do that here at our surgery center, which is in Building A at Ortho Georgia. And the majority of people do very well with that, especially if they do it for the reason of pain. The mobility is also very good after a joint replacement procedure. And then as we get further down into the hand, if you have arthritis at the base of the metacarpals, which are the bones that actually make up the bulk of your hand, then for the thumb, that can be replaced as well with basically your own tendons in that area. The remaining joints, unfortunately, we don't have any great treatments for those right now. However, those do very well with continued non-operative management, including cortisone injections. So if any of you have any issues with hand arthritis involving any of those joints, we would love to see you and take care of you here at Ortho Georgia.